Hey, welcome once again to Dr. Paula's Breast Health. We are back again with another session. It will be pertaining to cancer this time. It happened to be October Breast Cancer Awareness Month. Everywhere you turn is pink. Everything is painted in pink. It's the month where people they raise the awareness of the risk for coming down with cancer, and so you will hear it on the radio, you will see it posted everywhere. It's going to be breast cancer. There'll be a lot of luncheons, there'll be walks, there'll be fashion shows. It also happened to be the beginning of the flu season. The flu season goes from October and can go all the way to May, and so you are asking if I've had cancer in the past or if I'm going through cancer currently, can I get the flu vaccine? And the answer is yes. According to CDC and according to the American Cancer Society, the individual who is going through cancer treatment, or the individual who's had cancer treatment in the past, should get the flu vaccine. And the reason why you have to get the flu vaccine is because your immune system is not as healthy and strong as the normal individual who's never been through chemotherapy or never had radiation therapy, never went through cancer treatment. And so because your body is weaker, you need the antibodies that's going to protect you if you come in contact with the flu. And so, a little bit about the flu vaccine. Like I said, the flu vaccine enables your body to produce antibodies. So if you become exposed to the flu virus, then your body knows it and it fights it. Now, the flu vaccine can come in a couple forms. You can have the injection, which is made of the killed virus, and you can have the nasal spray, which is made of the live virus. Now, because the individual going through cancer treatment, or the individual who's had cancer in the past, because the immune system is weaker than that of a normal person, you must not take the live virus, which is the nasal spray. Because if you take the nasal spray, you are putting yourself at risk for the flu. What you want to take is the injection, which is the killed virus. And you hear a lot of people say, oh, I had the flu shot and I became sick and I had the body aches and I just swear I had the flu. Now with the injection, which is what most people take, and the nasal spray is kind of usually given to children. But if you have the injection, which is the killed virus, you cannot come down with the flu. What you're having is just reactions from the vaccine. So you may have a low-grade fever, you may have body aches, but you do not have the flu. And so the person who's going through cancer treatment should take the injection, which is the kill vaccine. Other things you want to do is you want to encourage the persons who are around you, the caretakers. If your mom is helping you, or your sister, or your auntie, or your husband, you want to encourage them to also be immunized. Because what's happening is, if the circle around you is immunized, it's indirectly protecting you, what we call herd immunity. And so if you have children in the household, you want to encourage them to be vaccinated. What you also want to do is to take the necessary precautions, to avoid yourself from coming down with the flu. So you want to make sure your hands are clean. You're also always washing, or you're using alcohol hand sanitizer. You want to make sure that you are avoiding people who are sick. So if anyone is coughing or sneezing, blowing their noses, you want to make sure you're avoiding them. You stay, far away from them, You also want to make sure that you're eating healthy and that you are getting enough sleep to boost your immune system. You want to just do everything that is necessary to prevent yourself from coming down with the flu. Because your immune system is weak, the complications from the flu, if you come down with it, if you're not protected and you didn't take the necessary precautions to prevent yourself from coming down with it, the risk for severe complications that can actually land you in the hospital is very great. And I'll tell you that every year, thousands of people are either becoming hospitalized, and some people are actually dying because of exposure to the flu, influenza virus. And so you're a breast cancer patient and you're going through active treatment, or you're a breast cancer survivor who's had chemotherapy in the past, you want to do everything necessary to prevent yourself from coming down with the flu. So the number one preventive method is by getting the vaccine. Be sure you check with your physician. You want to make sure that anything you do, especially when you're going through active treatment, that anything you do that you're getting the clearance from your doctor. And once your doctor gives you the clearance, you go ahead and you're becoming immunized. Happy Breast Cancer Awareness Month to everyone. You are on the move. I want you to do everything necessary to keep yourself healthy, to prevent yourself from coming on with the flu. You want to make sure that you're eating right, you're sleeping, you're getting your flu shot, you're avoiding sick people, and you're doing everything to keep yourself healthy. Hey, see you again next time. Dr. Paula's Breast Health. If you are watching this video for the first time and you have not subscribed, I'm coming out with more information on breast cancer, medication, treatment, surgical options, the triple negative breast cancer that's killing a lot of women. We will be coming up with so much education. We're going to empower you with knowledge. I want you to hit that red button, subscribe. I want you to share it with your friends, share it with your family, hit the bell, give it a thumbs up if you think that's important information. Please do not keep it to yourself. I want you to share it. Thank you. See you next time.